Welcome to Drona Institute of Ayurvedic Studies Ayurvijnana series, a series of Ayush-related general knowledge questions. Question number 81. The council established for the promotion of global export of Ayush products and services by Ministry of Ayush and supported by Ministry of Commerce and Industry, Government of India is Option A, Ayush Port, Option B, Ayush Expo, Option C, Ayush Excel, Option D, Ayush Visa. The correct answer is Option C, Ayush Excel. Ayush Excel is Ayush Export Promotion Council. It is an export promotion council set up by Ministry of Ayush and supported by Ministry of Commerce and Industry, Government of India, officially launched by Prime Minister Narendra Modi at Global Ayush Investment and Innovation Summit held in Gandhinagar, Gujarat on 20th April 2022. It is aimed to oversee exports of products of Ayurveda, homeopathy, Siddha, Sobarippa, and Unani systems, and to address trade issues pertaining to these sectors. It facilitates capacity building of its members on export procedures, organize B2B meetings, international events, roadshow, seminars, workshops on the export of Ayush products, and to safeguard the scientific research in the field of Ayush healthcare. Question number 82. Ayush visa was notified by which Ministry of Government of India? Option A, Ministry of Home Affairs. Option B, Ministry of Ayush. Option C, Ministry of Tourism. And option D, Ministry of Health and Family Welfare. The correct answer is option A, Ministry of Home Affairs. Ayush visa is specifically designed for foreign nationals looking to receive medical treatment in India through Ayush or other traditional Indian systems of medicine for therapeutic care, wellness, and yoga. An Ayush visa was notified by Ministry of Home Affairs, Government of India for foreign nationals for treatment under Ayush systems or Indian systems of medicine. A new chapter, Chapter 11A, Ayush Visa, has been incorporated after Chapter 11, Medical Visa of the Visa Manual, which deals with treatment under the Indian systems of medicine. Introduction of Ayush Visa category is part of India's roadmap for the Heal in India initiative of the government, which is intended at promoting India as a medical value travel destination. And Ministry of Ayush and Ministry of Health and Family Welfare are working together to develop a one-stop Heal in India portal to promote India as a medical tourism destination of the world. Question number 83. In August, the letter S stands for option A Siddha, option B standardization, option C Samvardhan, option D Samyojan. The correct answer is option C Samvardhan. August is Ayush Aushadhi Gunavatta Evam Ulpadan Samvardhan Yojana, and it is a central sector scheme for augmenting the quality of Ayush drugs. It is developed by Ministry of Ayush to regulate the quality and production of Ayurveda, Siddha, Unani, and homeopathy medicines. It operates under the framework provided by Drug and Cosmetic Act 1940 and its associated rules. The Ministry of Ayush has formulated August in the year 2021, and the objectives are to enhance India's manufacturing capabilities and exports of traditional medicines and health promotion products under the initiative of Atmanirbhar Bharat, to facilitate adequate infrastructural and technological upgradation and institutional activities in public and private sector for standardization, quality manufacturing, and analytical testing of Ayush drugs and materials, to strengthen regulatory frameworks at central and state level for effective quality control, safety monitoring, and surveillance of misleading advertisements of Ayush drugs, to encourage building up synergies, collaborations, and convergent approaches for promoting standards and quality of Ayush drugs and materials. And the components of Augasi are strengthening and upgradation of Ayush pharmacies and drug testing laboratories to achieve higher standards, pharmacovigilance of Ayurveda, Siddha, Unani, and homeopathy drugs, including surveillance of misleading advertisements, central and state regulatory frameworks, including technical, human resource, and capacity building programs for Ayurveda, Siddha, Unani, and homeopathy drugs, development of standards and accreditation or certification of Ayurveda, Siddha, Unani, and homeopathy products and materials in collaboration with Bureau of Indian Standards, Quality Council of India, and other scientific institutions and industrial research and development centers. Question number 84. Which of the following is not included in DM Ayurveda courses published in NCISM, Minimum Essential Standards, Assessment and Rating for PG Institutions, and Minimum Standards for PG Education in Ayurveda Regulations 2024? Option A, DM Asti and Sandhi. Option B, DM Kshara Sutra. Option C, DM Jara Chikitsa. Option D, DM Yegur Chikitsa. The correct answer is option B, DM Kshara Sutra. The National Commission for Indian Systems of Medicine, Minimum Essential Standards, Assessment and Rating for Postgraduate Institutions, and Minimum Standards for Postgraduate Education in Ayurveda Regulations 2024 was published on 1st October 2024. And in Chapter 11, Minimum Essential Standards and Minimum Standards of Education for institution or department offering super specialty program, DM Ayurveda is mentioned. And super specialty program, DM Ayurveda, are intended to produce super specialists with deeper understanding in Ayurveda classics with updated knowledge in contemporary sciences in relevant specialty area. And the DM program shall be of 3 years duration, and it shall be based on super specialty training for diagnosis and treatment, and shall include dissertation and case studies in addition to the training. And the eligibility criteria is postgraduate degree in Ayurveda. The annual intake capacity for all DM Ayurveda courses shall be maximum of 4 seats, and the super specialty program shall be conducted only in exclusive department. And these are the DM Ayurveda courses mentioned in the regulations. The first one is DM Manasa Roga Ayurveda Psychiatry. The department is Manovijnana Evam Manasa Roga. Second one is DM Vajikarana, Reproductive Medicine and Epigenetics in Ayurveda. The department is Vajikarana. The third one is DM Asti and Sandhi, Orthopedics and Arthrology in Ayurveda. The department is Asti and Sandhi. The fourth one is DM Arbuda Vijnana, Ayurveda Oncology. The department is Arbuda Vijnana. The fifth one is DM Jara Chikitsa, Ayurveda Gerontology, under Department of Rasayana. And the last one is DM Yegar Vigara, Ayurveda Hepatology. The department is exclusively Yegar Roga. Question number 85. The first edition of Ayurvedic Formulary of India, AFI, was published in the year. Option A 1968, option B 1978, option C 2003, option D 2011. The correct answer is option B 1978. Ayurvedic formulations are scattered in different texts of Ayurveda prescribed by Acharyas of different era, and there is a need for compiling and standardization of all the formulations for the proper utilization for Vaidyas and pharmaceutical industries, and it has resulted in the formulation of Ayurvedic Formulary of India, AFI. And it has three parts, part 1, 2, and 3. And the part 1 has 2 editions. The first edition was published in 1978 and second edition was published in 2003. They are having 444 number of formulations. Part 2 was published in 2000 and it is having 191 formulations, and part 3 was published in 2011 having 350 number of formulations. And the general structure of Ayurvedic Formulary of India is they are having the title of the formulation, ingredients, method of preparation, dose, anupana, therapeutic uses, and storage. The Ayurvedic Formulary of India Part 1 was included in the first schedule of Drug and Cosmetic Act 1940 to give it a legal status. Question number 86. Acharya Guru Shishya Parampara and Chikitsa Guru Shishya Parampara are courses conducted by option A National Institute of Ayurveda, option B Central Council for Research in Ayurvedic Sciences, option C All India Institute of Ayurveda, option D Rashtriya Ayurveda Vidyapeeth. The correct answer is option D Rashtriya Ayurveda Vidyapeeth. Rashtriya Ayurveda Vidyapeeth, also called as National Academy of Ayurveda, the director is Dr. Vandana Shiroha, and Rashtriya Ayurveda Vidyapeeth is conducting Guru Shishya Parampara program. And Guru Shishya Parampara is a traditional residential method of education wherein the Shishya lives in the vicinity of his Guru and undertakes the studies in a one-to-one manner by accompanying the Guru in his regular routine clinical work. And Guru Shishya Parampara program of Rashtriya Ayurveda Vidyapeeth provides the students to study whole text to get adequate knowledge of selected Samhita and its commentary and exposes them traditional skills of the Ayurvedic practices. Shishya gets sufficient time for interaction with the Guru and get a live demonstration upon the patients, herbs or formulations during the course of the study. And there are two programs or courses under Guru Shishya programs. The first one is Acharya Guru Shishya Parampara, or 2-year course of member of Rashtriya Ayurveda Vidyapeeth, MRAV, and Chikitsa Guru Shishya Parampara, 1-year course of Certificate of Rashtriya Ayurveda Vidyapeeth, CRAV. The MRAV is Acharya Guru Shishya Parampara, which is the 2-year course of member of Rashtriya Ayurveda Vidyapeeth, and it is an academic program based upon literary research imparting the knowledge of Ayurvedic Samhitas and commentaries to participants. The main of this course is to prepare good teachers, research scholars, and experts in Ayurveda Samhita. Shishya studies the Samhita related to his or her specialization in PG course under the guidance of the Guru for a period of 2 years. And RAV started this course in 1992 with an objective of preparing the postgraduate doctors as experts in classical text of Ayurveda. And at the end of the study, Shishya wants to submit a thesis, and there is a written examination and Viva voice. And CRAV is Chigilsa Guru Shishya Parambara, which is 1 year course of certificate of Rashtriya Ayurveda Vidyapit, CRAV. It was started in February 1999, and the course has a duration of 1 year for both Ayurvedic graduates and postgraduates. And in CRAV course, the candidates possessing BAMS or PG in Ayurveda are selected for training under eminent practicing Vaidyas who are empaneled as individual guru or institutional gurus. And during the course of this study, the students learn the procedures like Nadi Pariksha, Aushadhi Nirman, Kshara Sutra, Panchakarma, treatment of diseases, Netra Chikitsa, Asti Chikitsa, pertaining to the Ayurvedic system. And every month, the trainees are required to prepare a record of the patients they studied for a subsequent submission to Rashtriya Ayurveda Vidyapit. And the work done by Shishyas like patient history sheets, monthly study reports, etc. is examined in Vidyapit. And at the end of the study, Shishya wants to submit a monograph of 25 cases and there is a written examination and Viva voice. Question number 87. The level of ATAB accreditation in which training providers can apply for formal accreditation of their Ayurveda courses through independent assessments conducted by Ayurveda Training Accreditation Board, ATAB is option A, level 1, option B, level 2, option C, level 3, option D, level 4. The correct answer is option C, level 3. ATAB is Ayurveda Training Accreditation Board operating under Rashtriya Ayurveda Vidyapit, and it is a board established by the Ministry of Ayush, Government of India by Gazette notification dated December 2019. And the primary objective is to accredit Ayurvedic training courses conducted both within India and abroad, which does not fall under the purview of National Commission for Indian System of Medicine, NCISM Act 2020, and Indian Medicine Central Council, IMCC Act 1970, or any other regulatory bodies. And ATAB serves as a mechanism to ensure the uniformity, quality, and standardization of Ayurveda training programs and enhancing the credibility and effectiveness of Ayurvedic education. And ATAB, through its predefined standards, evaluates various aspects of Ayurveda training programs, such as curriculum content, faculty qualifications, infrastructure, and teaching methodologies. And there are 3 levels of accreditation, level 1, 2, 3. Level 1 is listing of training courses by creating an inventory of training courses available globally in Ayurveda. And level 2 is self-declaration of conformity to basic accreditation standard without any external intervention by ATAB or any other third party. Level 3 is basic accreditation of Ayurveda courses done by independent assessments conducted by Ayurveda Training and Accreditation Board. Level 1 and 2 do not provide any sort of accreditation to the Ayurveda courses of the institutions by ATAB, and level 3 is done by ATAB itself. Question number 88. ERSBK is the web learning portal initiative of option A, National Institute of Ayurveda, option B, Central Council for Research in Ayurvedic Sciences, option C, All India Institute of Ayurveda, option D, Rashtriya Ayurveda Vidyapit. The correct answer is option D, Rashtriya Ayurveda Vidyapit. ERSBK is web-based e-learning program for Rasashastra and Vaisheshya Kalpana RSBK education. It is a web learning portal initiative of Rashtriya Ayurveda Vidyapit. The primary aim of this program is to provide web-based learning of the pharmaceutical processes involved in the preparation of Ayurvedic drugs. It also aims to offer participants exposure through live demonstrations and practical experiences in pharmaceutical manufacturing units. ERSBK aligns with the vision of the Government of India to support the Atmanirbhar Bharat mission, helping participants create startups, generate employment, and contribute to the growth of Ayurveda pharma sector. Question number 89. Which of the following is not included in Ayurvedic Pharmacopoeia of India, API, Part 1, Volume 10, published exclusively for minerals and metals? Option A, Parada, option B, Gandhaga, option C, Lauha, option D, Sindhura. The correct answer is option B, Gandhaga. API is Ayurvedic Pharmacopoeia of India, published by Pharmacopoeia Commission for Indian Medicine and Homeopathy. And Ayurvedic Pharmacopoeia of India has two parts, part 1 and 2. Part 1 contains single drugs and part 2 contains formulations. And part 1 has 10 volumes having detailing of 665 drugs as monograph, and part 2 has 4 volumes having detailing of 202 formulations as monograph. And Ayurvedic Pharmacopoeia of India, Part 1, Volume 10, is exclusively for minerals and metals, and it was published on 2022. And there are 20 drugs, and they are Haridala, Hingula, Soraga, Kamsya, Lauha, Sindura, Malla, Manashila, Vimala, Mradara Shringa, Naga, Vanga, Navasara, Parada, Yashada, Pittala, Saurashtri, Sorjigakshara, Saindava Lavana, and Sauvarchana Lavana. Question number 90. Namaste portal is designed, developed, and maintained by option A, Central Council for Research in Ayurvedic Sciences. Option B, All India Institute of Ayurveda. Option C, Institute for Teaching and Research in Ayurveda. Option D, National Institute of Medical Statistics. The correct answer is Central Council for Research in Ayurvedic Sciences. National Ayush Mobility and Standardized Terminology Electronic Portal, Namaste, is a comprehensive web portal for standardized terminologies and national mobility codes of Ayurveda, Siddha, and Unani systems of medicine and WHO ICD-10 and 11. And it is a web-based resource consolidating mobility statistics from different healthcare organizations, HCO, under Ayush system nationwide in India. And Namaste portal is implemented and maintained by National Institute of Indian Medical Heritage, Hyderabad, under the Central Council for Research in Ayurvedic Sciences, Ministry of Ayush, Government of India. It was launched by Indian Prime Minister Sri Narendra Modi on 17th of October 2017 at All India Institute of Ayurveda, New Delhi. And the mission of Namaste portal is pan-Indian implementation of Ayurveda, Siddha, Unani national mobility codes for reporting mobility and treatment outcome, along with ICD-10 and 11 dual coding system, pan-Indian implementation of ICD-10, 11 disease codes for yoga, naturopathy, and homeopathy systems of medicine for reporting mobility and treatment outcome, serve as reference repository of Ayurveda, Siddha, Unani terminologies and mobility codes for further development of ASU international terminologies and ICD-11 mobility codes. And Namaste portal contain Ayurveda, Siddha, Unani, international terminologies and codes for ICD-11, Chapter 26, Traditional Medicine, Module 2. And Namaste portal has 2,888 national Ayurveda mobility codes, 1,926 national Siddha mobility codes, 2,500 national Unani mobility codes, and standardized Ayurveda, Siddha, and Unani terminologies. And Ministry of Ayush has initiated collection of mobility data and implemented the standards of electronic health records across the Ayush domain of patients approaching Indian systems of medicine and healthcare organizations. And the data of the patients attending OPD during various outreach programs is also recorded in this portal by the concerned healthcare organizations of Ayush. Question number 91. Ayurveda Network is an initiative of Faculty of Ayurveda of option A, All India Institute of Ayurveda, option B, Gujarat Ayurveda University, option C, Jawaharlal Nehru University, option D, Banaras Hindu University. The correct answer is option D, Banaras Hindu University. Ayurveda Network is a network of experts established under Pandit Madan Mohan Malaviya National Mission on Teachers and Teaching of the Ministry of Human Resource Development, Government of India. And it is an initiative of Faculty of Ayurveda, Banaras Hindu University. The Ayurveda Network has been done under subject-based network component of PMM NMTT program. The Pandit Madan Mohan Malaviya National Mission on Teachers and Teaching aims to infuse innovation in teaching leading to better learning outcomes. And this program focuses on integrated teacher education programs to cater to the professional development needs for both pre-service and in-service teachers and faculty. The Ayurveda Network initiative is being supported by Ministry of Ayush under the Ayurvijnana Central Sector Scheme for web-based educational programs being coordinated by Rashtriya Ayurveda Vidyapeeth, New Delhi since February 2022. And the outcomes are development of a web-based platform, Ayurveda Network BHU.com, development of e-content, which is relevant for students, teachers, and professionals of Ayurveda, e-content preparation in the form of articles, slide presentations, video lectures, audio lectures, and other relevant documents, organized several symposia, workshops, invited lectures, CMEs and expert meetings, and published review and research papers in reputed scholarly journals, published an ebook titled Clinical Experiences of an Ayurvedic Practitioner, authored by Professor Muralidhar Sharma, and the release of this book took place at the Transdisciplinary University, Bengaluru. The coordinator of Ayurveda Network is Professor Kishore Padwardhan, Faculty of Ayurveda, Institute of Medical Sciences, Banaras Hindu University, and the co-coordinators are Professor Manoj Kumar and Professor KHHVSS Narasimhamurthy, who are faculty members of Institute of Medical Sciences, Banaras Hindu University. Question number 92. Vice Chancellor of Dr. Sarvepalli Radhakrishnan, Rajasthan Ayurveda University, Jodhpur is option A, Professor Sanjeev Sharma, option B, Professor Pradeep Kumar Prajapati, option C, Professor Vaidya Kartar Singh Dhiman, option D, Dr. N.K. Manjunath. The correct answer is Professor Pradeep Kumar Prajapati. The vice chancellors of different Ayush universities in India are mentioned in the table. The Vice Chancellor of National Institute of Ayurveda, deemed to be University, Dinova, Jaipur, Rajasthan, is Professor Sanjeev Sharma. The current Vice Chancellor of Dr. Sarvepalli Radhakrishnan, Rajasthan Ayurveda University, Jodhpur, is Professor Pradeep Kumar Prajapati. The Vice Chancellor of Gujarat Ayurveda University, Jamnagar, Gujarat, is Vaidya Naresh Kumar D. Jain, who is in charge. The Vice Chancellor of Sri Krishna Ayush University, Kurukshetra, Haryana, is Professor Vaidya Kartar Singh Dhiman. The Vice Chancellor of Swami Vivekananda Yoga Anusandhana Samsthana, S. Vyasa University, Bengaluru, Karnataka, is Dr. N.K. Manjunath. The Vice Chancellor of Mahayogi Guru Goraknath Ayush University, Uttar Pradesh, is Professor K. Ramachandra Reddy. The Vice Chancellor of Guru Ravidas Ayurveda University, Hoshiarpur, Punjab, is Dr. Sanjeev Sood. The Vice Chancellor of Pandit Deen Dayal Upadhyaya Memorial Health Sciences and Ayush University of Chhattisgarh is Dr. P.K. Patra, and the Vice Chancellor of Uttarakhand Ayurveda University, Dehradun, Uttarakhand, is Dr. Arun Kumar Tripathi. Question number 93. Ministry of Ayush has nominated Dash as a nodal institute for the execution of Central Sector Scheme for Skill Development under Champion Services Sector Scheme, CSSS, for medical value travel in different states. Option A, Institute of Teaching and Research in Ayurveda, Jamnagar. Option B, All India Institute of Ayurveda, New Delhi. Option C, Central Council for Research in Ayurvedic Sciences, New Delhi. Option D, National Skill Development Corporation. The correct answer is option B, All India Institute of Ayurveda, New Delhi. The Ministry of Ayush had developed a central sector scheme under the Champion Services Sector Scheme, CSSS, medical value travel, with a component of skill development to fill the gap in the availability of skilled manpower so that skilled human resources could be developed along with capacity building of existing skilled human resources. And this list of skilled manpower needed are masseurs, Prakriti analyst, Marma therapist, yoga therapy assistants, Panchakarma technician, Ayurveda dietitian, Ayurveda Ahar and Poshan Sahayak, Ksharakarma technician. The Ministry of Ayush has nominated All India Institute of Ayurveda as a nodal institute for the execution of the Champion Service Sector Scheme, medical value travel with skill development component in 8 states, and its states are Delhi, Himachal Pradesh, Punjab, Jammu and Kashmir, Ladakh, Chandigarh, Uttarakhand, and Haryana. And the objective of this scheme is to develop Ayush-specific skilled human resource, capacity building of existing human resources, to promote export of services, to develop supporting structure for Ayush healthcare services. And 12 short-term courses have been approved under the Champion Service Sector Scheme, and they are Saundarya Ayurveda, Sensitizing Healthcare Professionals in Ayurveda, Research Methodology, Prakriti Analyst, Jana Sahayak, Elderly Caregiver, Emergency Management Course, Cupping Therapy Assistant, Dark Therapy Assistant, Foundation Course in Yoga Science for Wellness, Panchakarma Paricharaga Basic Course, technical assistant course in three Prasudi local procedures, Kshara Karma technician training program. Question number 94. The Public Health Initiative Project Karunya of National Ayush Mission NAM is related with option A, Ayush Maternal and Neonatal Intervention, option B, Ayush Geriatric Healthcare Services, option C, Ayush Palliative Care Services, option D, Ayush Morbidity Management and Disability Prevention of Lymphatic Filariasis. The correct answer is option C, Ayush Palliative Care Services. NAM is National Ayush Mission. It is a centrally sponsored scheme focusing on preventive and promotive aspects of healthcare. And National Ayush Mission was launched on September 2014. And the objective of National Ayush Mission is to strengthen Ayush services through increased accessibility and availability in the states. And the components are Ayush services, support to Ayush educational institutions, and quality control of drugs. And the National Ayush Mission is currently having different public health initiatives, and they are Karunya, which is Ayush Palliative Care Services for improving quality of life of palliative patients, Supraja, which is Ayush Maternal and Neonatal Intervention through Ayush Teaching Hospitals, Vayomitra, Ayush Geriatric Healthcare Services for senior citizens, Ayurveda, which is a program for promotion of healthy lifestyle in schools through Ayush systems, Ayush Mobile Medical Unit, which is a healthcare in underserved and far-flung areas through Ayush system. And National Ayush Mission is also participating in different national health programs, and they are National Program for Prevention and Management of Osteoarthritis and other musculoskeletal disorders, National Program on Ayush for Morbidity Management and Disability Prevention, MMDP, of lymphatic filariasis, lymphedema, and integration of Ayush with National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Disease, and Stroke, NPCDCS. Question number 95. The standardized Ayurveda mobility code of Sandigata Vada, according to Namaste portal, is option A, AAB 37, option B, AAC 20, option C, AAB 80, option D, AAE 16. The correct answer is AAE 16. National Ayush Mobility and Standardized Terminology Electronic Portal. Namaste. It is a comprehensive web portal for standardized terminologies and national mobility codes of Ayurveda, Siddha, and Unani systems of medicine, and WHO ICD-10 and ICD-11. And the Namaste portal has 2,888 national Ayurveda mobility codes and 1,926 national Siddha mobility codes and 2,500 national Unani mobility codes. And the Ayush mobility codes of the diseases are AA, Vadavyadi, AAE 16, which is Sandigata Vada, which is sequestian. AAB 37 is Gridrasi Kevalavada. AAC 20 is Gridrasi. AAC 24 is Pakshakada. AAB 52 is Pakshakada Kevalavada. AAC 32 is Manyastamba. AAC 8 is Ababahuga. And EC 6 is Amavada. Question number 96. Ayush mobility codes are included in the WHO International Classification of Diseases, ICD-11, Traditional Medicine, Chapter 26. Option A, Module 1. Option B, Module 2. Option C, Module 3. Option D, Module 4. The correct answer is option B, Module 2. The Ministry of Ayush, in collaboration with World Health Organization, has prepared classification of diseases used in Ayurveda, Siddha, and Unani systems, and these mobility codes are included under International Classification of Diseases, ICD-11, Traditional Medicine, Chapter 26, Module 2. And ICD is a globally recognized system for classifying and coding health conditions, enabling healthcare providers to communicate, track, and analyze health data across infectious and chronic illnesses. And its significance for Ayush is it is a common language paving the way for research and collaboration, high quality data collection for large scale evidence generation. Ayush system will gain global recognition, leading to wider acceptance and use, and standardized terms could lead to insurance coverage and medical tourism opportunities. And it will provide a common language that allows health professionals to share standardized information across the world. And the launch of WHO ICD-11 TM Chapter 26 Module 2 was done on 10 January 2024 at Indian Habitat Center, by Dr. Munjapada Mahendra Bhai, Honorable Minister of State, Ministry of Ayush, in the august presence of Dr. Rudy Eggers, Director of Integrated Health Services at World Health Organization, Geneva, and Dr. Rodrigo H. Offrin, WHO Representative to India, World Health Organization, and Dr. Madhu Raikwar, Director, Central Bureau of Health Intelligence, DGHS, Ministry of Health and Family Welfare, Government of India. And this effort will further strengthen and expand India's healthcare delivery system, Ayush insurance coverage, research and development, and policy making system. And the Ayurveda Siddha Unani codes can also be used to formulate future strategies to control various diseases in the society. Question number 97. Ministry of Ayush launched the Indian Public Health Standards for Ayush healthcare facilities on option A 2022, option B 2023, option C 2024, option D 2025. Correct answer is option C 2024. Ministry of Ayush launched the Indian Public Health Standards for Ayush healthcare facilities on 4th March 2024. The Indian Public Health Standards for Ayush healthcare facilities have been prepared in consultation with National Institution for Transforming India, Niti Aayog, and Directorate General of Health Services, DGHS. The IPH standard for Ayush mark a significant step to ensure uniform quality in Ayush infrastructure, human resources, and medicines to enhance Ayush healthcare services nationwide by establishing consistent benchmarks for facilities across the country and to ensure better access and quality of care for the population. UN General Assembly declared the World Meditation Day on option A 21st June, option B 21st July, option C 21st November, and option D 21st December. The correct answer is option D 21st December. The UN General Assembly declared the World Meditation Day on 21st December 2024. The World Meditation Day should be celebrated on every year on 21st December. The Central Research Institute of Yoga and Naturopathy, CRIYN, Rohini, New Delhi, organized World Meditation Day by conducting an event aimed at promoting well-being and mindfulness meditation among staff, OPD patients, and yoga practitioners. Question number 99. Desh Ka Pragati Parikshan campaign was launched by option A, Srimati Draupadi Murmu, option B, Sri Narendra Modi, option C, Vaidya Rajesh Kotecha, option D, Professor Thanuja Nesari. The correct answer is option B, Sri Narendra Modi. The Desh Ka Pragati Parikshan initiative under the Ministry of Ayush aims to bring Ayurveda to every individual's doorstep by helping people know about their unique Prakriti or Ayurvedic body type. And based on their Prakriti, people will receive lifestyle recommendations that include daily routines, dietary advice, exercise, yoga, and seasonal adjustments. And Desh Ka Pragati Parikshan national campaign is managed by National Commission for Indian Systems of Medicine, NCISM, with the help of CSIR IGAB, and aims to help inspire individuals across India to incorporate Ayurveda-based lifestyle practices. And Indian Prime Minister Sri Narendra Modi launched Desh Ka Pragati Parikshan, promoting health awareness and highlighting the importance of holistic well-being in daily life. And the key initiatives are educate citizens about the significance of Ayurveda and individual constitution in maintaining health, help individuals to understand their body type and adopt suitable Ayurvedic practices for health preservation, generate a large research sample helping the country map the Prakriti of its citizens, contribute to the growth of Ayurvedic research and policy making. And the first phase of the Abhiyan saw an extraordinary response, conducting Pragati Parikshan for over 1.29 crore individuals, surpassing the target of 1 crore in India. And the National Commission for Indian System of Medicine, with the support of Ministry of Ayush, Government of India, concluded the closing ceremony, marking the completion of the first phase of Desh Ka Pragati Parikshan Abhiyan on 28 February 2025 at Mumbai. Question number 100. Which of the following Ayurveda mobility card in Namaste portal is wrongly matched? Option A, EA4 Swasa. Option B, EE3 Arshas. Option C, E5F 2 4.4 Madhumeha. Option D, EC6 Pandiroga. The correct answer is option D, EC6 Pandiroga, which is wrongly matched. National Ayush Mobility and Standardized Terminology Electronic Portal, Namaste, is a comprehensive web portal for standardized terminologies and national mobility codes of Ayurveda, Siddha, and Unani systems of medicine and WHO ICD-10 and 11. And Namaste portal has 2,888 national Ayurveda mobility codes, and among these, Ayush mobility codes, these are important. EA4, which is corresponding to Shwasa, EE3, Arsha, EF2.4.4, Madhumeha, EC5, Panduroga, EC6, Amavada, EA3, Kasa, ACB17, Damani Pratichaya, ED4, Kushta, AAC 12.4, Vibanda, EF3, Medo Roga, EK4, Udara Roga, EL 2.24, Vandya, EM3, Abasmara, FA3, Kalitya, HG1, Timira, I1, Pradishaya or Pinasa, MD11, Daurbalya, and EE2, Arbuda. Thank you.